250,000 people will suffer serious burns in the UK this year. And if those burns become infected, the patient is at risk of blood poisoning and even death. Doctors know it's incredibly hard to get rid of any infection, even with the use of antibiotics. Well, now researchers in Birmingham say ordinary vinegar may be the answer. Our science correspondent David Gregory-Kumar is with me now. David, is vinegar really effective against what could be life-threatening infections?
Actually, Mary, yes, it is. Here are some of the bugs they've been testing vinegar against in the laboratory. There is E. coli, there's MRSA down there, and in the middle there's Pseudomonas. Now this one is a real problem, especially for burn victims.
An infection with this bacteria on the surface of their skin, and the longer that stays there, the longer that bug stays on the skin, the more likely they are to get blood poisoning, and that's really serious. So they're more likely to die if they get blood poisoning.
Well, here's Pseudomonas, that lethal bug up close, as you can see it there. So why is it so hard to deal with? Well, once it infects a wound, it forms something called a biofilm.
A biofilm is just like a collection of different bacteria in like a sticky, gooey kind of mess. And they tend to form on vulnerable wounds, such as burn wounds, and they're very difficult to eradicate. So that's why we're trying to use vinegar to see whether this can actually disrupt the biofilm, take it apart and destroy the bugs themselves.
And it does. Here it is working in the lab. Now, blue means there is infection and also no vinegar, but paler blue and white means vinegar has been used and the infection is gone.
Acetic acid has been used since before the birth of Christ, and essentially, acetic acid is vinegar, and it's as simple as that. And people have been using acetic acid as an antimicrobial in lots of ways for a very, very long time. But there's a almost unbelievably scant evidence base for how it works, when it works, against which type of bugs, and hopefully we're beginning to fill that gap, and that's what we're aiming to do more of in the future.
Now already this idea is being used at the Queen Elizabeth Hospital in Birmingham, and now a pilot clinical trial is coming. The end result could be an effective and cheap new treatment for the NHS. Mary.
It's not just for your chips. David, thanks very much.